Salty breakfast cereals are one of the most overlooked dietary hazards for people with high blood pressure. While most people associate cereals with sugar content, many savory or lightly salted cereals also contain surprisingly high levels of sodium. For individuals managing hypertension, this seemingly benign morning staple can quietly contribute to elevated blood pressure, fluid retention, and long-term cardiovascular damage. The danger is compounded by the fact that cereals are often consumed daily, meaning even moderate sodium levels can accumulate into a significant cumulative effect. Many savory or fortified cereals contain between 150 and 400 milligrams of sodium per serving. While this may not seem alarming at first glance, it is important to remember that people rarely stop at a single serving. A generous bowl often doubles or triples the sodium intake listed on the packaging, and topping cereals with salted nuts, dried cheese, or even flavored yogurt can further elevate the sodium load. For hypertensive individuals, this daily repetition translates into constant stress on the arteries, heart, and kidneys, contributing to a slow but relentless progression of vascular damage. The primary mechanism of harm, as with most high-sodium foods, is fluid retention. Sodium attracts water into the bloodstream, increasing blood volume and placing additional pressure on arterial walls. Over time, this chronic increase in pressure forces the heart to work harder, accelerating the stiffening of arteries and contributing to conditions such as left ventricular hypertrophy. Habitual exposure to high-sodium cereals therefore not only raises blood pressure acutely, but also promotes long-term structural changes in the heart and vessels, silently worsening cardiovascular risk without immediate symptoms. Salty cereals also frequently contain other hidden risks. Some are fortified with processed flavorings, preservatives, or texturizing agents that, while not inherently dangerous in isolation, may contribute to inflammation and endothelial stress when consumed alongside high sodium levels. Additionally, many cereals include refined grains, which spike blood sugar and insulin. Chronic insulin spikes can exacerbate hypertension by promoting weight gain, insulin resistance, and metabolic syndrome, creating a compounding effect where sodium and refined carbohydrates work together to damage vascular health. The habitual nature of breakfast consumption makes this risk particularly insidious. Unlike snacks or occasional meals, breakfast is eaten daily, which means even a moderate amount of sodium each morning can accumulate over weeks, months, and years. Unlike the obvious saltiness of chips or pretzels, the sodium in cereals is often hidden, allowing people to consume dangerously high levels without ever realizing it. This stealth accumulation quietly contributes to arterial stiffening, kidney stress, and increased cardiac workload, setting the stage for long-term complications such as stroke, heart attack, and chronic kidney disease. Many people also combine salty cereals with other high-sodium foods at breakfast, such as bacon, cheese, or salted spreads, which further amplifies the problem. The cumulative sodium load from a single meal can easily exceed safe limits for individuals with hypertension, leading to spikes in blood pressure and fluid retention that, over time, cause persistent damage to the cardiovascular system. Even those who maintain a generally healthy diet elsewhere are not immune, because daily repeated exposure to sodium in breakfast cereals alone can create a dangerous baseline level of stress on the body. Another subtle but important factor is the displacement of protective foods. Frequent consumption of salty cereals often comes at the expense of fresh fruits, vegetables, and whole grains, foods rich in potassium, magnesium, and fiber that help counterbalance sodium's effects on blood pressure. By replacing these protective nutrients with high-sodium, refined grain products, individuals inadvertently tip the balance toward hypertension and vascular damage, undermining overall cardiovascular resilience. Finally, the danger of salty cereals is cumulative and often invisible. Blood pressure may creep upward gradually, kidney function may decline slowly, and arteries may stiffen silently, all while the individual feels normal. By the time obvious symptoms appear, such as headaches, swelling, or hypertensive crises, the cardiovascular system may already have suffered significant structural and functional damage. This silent progression makes salty breakfast cereals particularly insidious, a seemingly harmless morning routine that slowly erodes heart and vascular health over time. In conclusion, salty breakfast cereals, particularly savory or fortified varieties, are far more than a minor dietary indulgence. Their high sodium content, combined with hidden additives, refined grains, and daily habitual consumption, creates a silent but potent threat for people with high blood pressure. Regular intake promotes fluid retention, arterial stiffening, heart strain, and long-term kidney and vascular damage. For hypertensive individuals, these cereals are not just an innocent morning convenience. They are a hidden hazard that requires vigilance, careful label reading, and ideally replacement with lower sodium, nutrient-rich alternatives to protect long-term cardiovascular health.